All right, so here we have a 10-year-old girl brought to the pediatrician by a grandmother for evaluation, sudden onset of clumsiness, personality changes. And the grandmother reports the girl has been frequently dropping things, stumbling, displaying a jerky limb movements that worsen, trouble controlling her volume as well, you might see. The child has become emotionally labile and frequent outbursts. The child has a sore throat and fever. And also there's a cardiac auscultation of a new holosystolic murmur on the apex. Okay, heard of the apex. What would they be like? All systolic, so mitral regurgitation. And so that makes you think of rheumatic fever. So on exam, there are several painless, serpingeous, erythematous skin lesions on her trunk. What best explains these findings? Okay, so we've talked a little bit about this, but this is going to be acute rheumatic fever. We have how it typically progresses is you get strep A, pharyngitis, and then you get the M protein, the activation of the B cells and the CD4 T cells. And these guys are going to activate, and there's cross-reactive responses in the cardiac proteins, and that causes the carditis with ASHF bodies. So if you have acute rheumatic fever, basically it's a cross-reacting, the GAS group A streptococcal infection will cross-react with the host tissues to molecular mimicry between the GAS antigens, the group A strep antigens, and the cardiac central nervous system antigens. And basically, antibodies will then try to attack these antigens and the M protein, and then they will subsequently attack the myosin as well, the cardiac protein, lysoganglioside, and then everything goes bad. And so you get this mitral regurgitation. And so just to explain this super duper duper simply, basically what they're getting at is, hey, do you know this is acute rheumatic fever? Do you know the autoimmune pathogenesis of these neurological manifestations? And this is molecular mimicry. It's when the antibodies, so we'll kind of scroll down here, the molecular mimicry of bacterial antigens leading to autoimmune activation. So you cross-react with host antigens due to their structural similarity. And in rheumatic fever, the antibodies will attack the cardiac myosin and also the basal ganglion neurons. That's the Sydenham chorea, and also the skin and joints. That's erythema marginatum and arthritis. So think of the Jones criteria. Type 2 hypersensitivity reaction, antibody-mediated cytotoxicity leads to the inflammation of multiple organs. So in the CNS, you get cross-reactive bodies that disrupt the neurotransmitter regulation, stopping the dopaminergic pathways in the basal ganglia, causing choreiform movements and emotional instability. So that's what's happening in this patient. And B, autoantibodies targeting the NMDA receptors in the basal ganglia. That would be anti-NMDA receptor encephalitis. That typically presents with psychiatric symptoms, seizures, and autonomic instability, and it's not going to be associated with your group A streps at all. Neurotoxicity due to circulating immune complexes and complement deposition. This is going to be your type 3 hypersensitivity reaction, serum sickness, post-streptococcal glomerulonephritis, not your Sydenham chorea. So you're not going to have that molecular mimicry. That's going to be a type 3 hypersensitivity, so forget about it. Direct invasion of the CNS by group A strep. That one's nice because it has a group strep in it, a group A strep in it. But it does not invade the CNS in rheumatic fever. That's not an autoimmune process. It is an autoimmune process. It's not an infection like CNS that is a process like meningitis, for instance. This is autoimmune, and this is the molecular mimicry. So it's not invasion of the CNS by rheumatic fever. So that's why it's not D. Dopaminergic receptor blockade by post-infectious lymphocytes. So yeah, well, dopamine dysregulation contributes to chorea. That's true. The underlying mechanism is going to be antibody cross-reactivity. And chorea, by the way, is a neurological disorder where you have spasmic, involuntary movements of the limbs and the facial muscles. That's what chorea is, right? You can't control it. And so this mechanism is going to be antibody cross-reactivity, molecular mimicry, not lymphocyte-induced receptor blockade. So this is going to be a non-step 1 relevant mechanism. And yeah, no, not dopaminergic. Due to like post-infectious lymphocytes. No. So this is going to be rheumatic fever, type 2 hypersensitivity reaction, follows untreated group A strep. Jones criteria is joints, joints. That's a migratory polyarthritis. O, it looks like a little heart. So think of it as Jones, but it's like a heart. So it's a carditis. Nodules, it's going to be subcutaneous nodules. Erythema marginatum is going to be E. And then also your Sydenham chorea is going to be your S. And so, yeah, that's the gist of it. Recent strep throat, erratic movements, so he's got strep, he's got erratic, he's got chorea, he's got heart murmur, just like rheumatic fever. quacks like a duck, looks like a duck. What is it? It's going to be your group A streptococcus associated rheumatic fever symptoms. So there we have it, folks. Watch out for that cross-reactivity of the GAS antigens. It's going to cause the myosin in the heart and pancarditis and the lysoganglionocyte in the neurons in the basal ganglia causing the chorea. So hopefully this is a helpful question. I think it's a good question, right? I think it's got some decent, juicy kind of factoids in this. If you guys like this kind of content, let me know. Please like and subscribe. Let me know how I can change. If there's anything you want me to see or just like improve on, if you want to change the color in the back, you want me to start wearing cooler shirts, whatever it is, just let me know. I'm going to be releasing hopefully some AI music onto this platform as well, so you guys can listen to some songs. Wouldn't it be cool? Comment below if you're like, yeah, I want to hear songs about Strep A. I want to hear about the clustering and its Staph aureus gram positivity. If that's you, then you're in the right place. And if not, then I don't know if I'll even do it. So maybe you're still in the right place. But we'll see you in the next video. Take care of yourselves out there.